Hello, Grant Foley here at the Midwest Center for Joint Replacement. Today we're going to be stepping you through the exercises that you'll need to do leading up until surgery. So there's two important reasons we feel like you need to dedicate yourself to these exercises. Number one, if you familiarize yourself with the exercises now, it's one less thing that you have to concern yourself with after surgery when you're busy with recovery. Number two, you'll gain some strength and some range of motion, some joint flexibility, which will also help your recovery. We just want to say thank you for choosing us as your team to lead you through the joint replacement process. We don't take that lightly, and we've got a group of people that are super passionate about what we do. And so if you have questions or concerns along the way, feel free to reach out to us at the number on the screen, or you can visit our website for additional information. So we hope you find this video helpful and a useful tool to further understand these exercise concepts. Hey guys, this is Ellen. Ellen's been kind enough to join us here to demonstrate your exercises that you're going to be doing leading up until surgery. So this is the quadricep set, the muscle on the top of the thigh. You're going to tighten up, hold that contraction 5 seconds, then relax. It's just going to drive the knee downward into the straight position. You're going to do 10 repetitions 1 time a day. So the only thing that we want to do here is just pause for a second and really think about, even though it sounds a little strange, what it feels like to tighten this muscle. Some of the connectivity from the brain to the muscle gets interrupted following the surgery. So the muscle memory that you create now could help you regain that ability to tighten that muscle a little easier afterwards. So that's a quadricep set. Hey, it's just going to be good to understand you're going to be doing these exercises on your bed. Not everybody's going to have a table. Sometimes the bed's too soft, but that's probably the best you can do. The floor is going to be a little tricky to get up and off of with a painful hip or knee. And also want to make sure to remind you guys to do these exercises on both legs. And it's going to be really helpful to have both sides as strong as possible to recover from your surgery. Exercise number 2 on page 1 is just the heel prop. All you're going to do, this is just a rolled up, there's a couple bath towels I've just taped together just to give it a bit more substance. You're going to place that right underneath the heel. Let the leg relax. You don't really even actively have to do anything. It's just gravity and the weight of the legs just pulling the knee down into the straight position. You really need to let that rest there for a few minutes, 3 to 5 minutes, I think is what it says on the page. If your pain level starts to get above kind of the 2 or 3 out of 10 pain range, you're just going to irritate it more than you're going to help it. So at this point, you just remove it, take it down, and just maybe build up your time. It says between 3 to 5 minutes, so just see how that feels with your pain level. So that's the heel prop. Okay, the last exercise on the first page is just the ankle pump. So you're going to scoot down to the edge of the bed, and just simply all you're going to do is just flex the foot back towards you. Hold that 5 seconds. Point it down the other way. Hold 5 seconds. You're going to do 10 repetitions twice a day on that one. Okay, so we're on to page number 2 of your preoperative set of exercises. This is the glute set. So all you're really going to do, you're just squeezing the rear end muscles. Super simple. So you just tighten, hold for 5 seconds, relax. I'm going to trust Ellen's doing this one well. That's the glute set. Hold 5 seconds, 10 repetitions 1 time a day. Exercise number 2 on the second page, the calf stretch with a towel. We've just got a blanket here. You're probably going to need a beach towel or something a little bit longer just to make sure that you can reach it comfortably. Loop that around the front part of your foot. You're just going to pull back. You're going to hold that 10 seconds. Feel that stretch up the back part of your leg and the calf. Then you're going to relax. Relax for a moment or two. You're going to do 5 repetitions 1 time a day, holding each stretch 10 seconds. That's the calf stretch. Okay, so the third exercise on the second page are your preoperative set standing heel raises. So you're just going to pull over a chair from your kitchen to your dining room, and you're just going to use that just for balance, really. You don't want to lean on it. So we're just going to come up on the toes. So Ellen's just going to lift her weight up on her toes, hold for a second, come back down. So you don't need to hold those for very long. Come up, hold for a second, back down. You're doing a set of 10, rest for a minute or two, 2 sets of 10, 1 time a day. Third exercise on the second page, the seated hamstring stretch. So you're just going to grab a chair, scoot to the edge of the chair. You're going to pull that toe back towards you so it's pointed up towards the ceiling. Ellen's just going to lean forward from her waist. You want to lean forward far enough where you feel that stretch up the back of the leg. In that hamstring, you're going to hold that 10 seconds, rest for a couple moments, 10 repetitions. So hold 10 seconds, 10 repetitions, 1 time a day. All right, last exercise on page 2. Ellen's going to lay down on her back. You're going to bend one knee. You're going to be doing these on both legs, so it doesn't matter which one you start with. You're going to pull your foot back towards you, tighten up this muscle. You're going to lift that leg about a foot up off the bed, pause for a second, come back down. Okay, so good, smooth, slow, controlled motion. You want that smooth, controlled motion on everything. You don't want to come up here and then just kind of let it flop back down. You want to make sure that you control that movement, okay? So 10 repetitions on the right. She's going to switch, bend this knee up, straighten the other knee out. Same thing, pull the toe back, lift about a foot up, pause for a second, come back down. 10 repetitions on that side, 1 time a day. You can work towards a second set of 10 as well. Make sure again on this one, sometimes for the hip folks, this one can become irritating. So if it gets more than just a 1 or a 2 out of 10 pain, again, we want things to be helpful, not irritating. So if it's more irritating, it kind of gets to that mid-level pain, cut it out. All right, moving on to page number 3 on the preoperative set. This is going to be the heel slide. So all Ellen's going to do is just kind of slide her heel as she bends her knee up the table or up the bed. When you feel a little tightness or stiffness in the knee or in the hip, that's real. Just pause and hold for 5 seconds. Let it come back down. 10 repetitions on either side. Okay, 1 time a day. That's heel slide. All right, so we're going for the knee extension exercises. This is the second exercise on the last page of the preoperative set. Ellen's just going to lift her foot up. Just tightens the muscle in this quadricep here. Pause for a second, let it come back down. Control the motion. Come back up again. You're going to do 10 repetitions. Then you're going to switch, do 10 repetitions on the other side. 2 sets, 1 time a day. So that's the knee extension exercise, working on this muscle here. So the third exercise on the last page, hip abduction. Ellen's going to use the same chair. You're just using it for balance. You're not leaning on it with your weight. She's just going to pick the right leg up, kick that leg to the side, pause for a second, control the movement on the way down. You don't want to go up so high where you're leaning the other direction. So you're going to do 10 repetitions on the right, 10 repetitions on the left, 1 time a day. The seated heel slide, and this is just for the knee folks only, okay? So if you're going in for a hip operation, you don't have to mess with this exercise. So all Ellen's going to do is scoot the edge of the chair. Now normally you're going to be on a hard surface like tile or hardwood floor. We're on carpet here, but you'll still get the concept. And all Ellen's going to do is just slide her right foot back underneath the chair. It's going to be a lot harder to do that once you have your operation, but you're going to feel some tightness in the knee. You're going to hold that about 5 seconds. Let the foot come back out, okay? So probably it's going to look like coming from this position, sliding it back, planting your foot, hold that a good 5 seconds. You'll probably feel some stiffness or discomfort in that knee, and then you'll kick it back out and rest it. 10 repetitions. Go ahead and do 10 repetitions on both sides. That's the heel slide.